Hello, my name's Dr. Nadira Awal. I'm founder of Pause & Co Healthcare, a GP and a menopause specialist. I see patients privately from the comfort of their own home, and my focus is around education and empowering you to help you live your best life. So we continue our mini-series during Menopause Awareness Month, and today we're going to speak about noradrenaline and GABA, which are two receptors that play important roles in mood, anxiety and sleep. Now, noradrenaline is an excitatory neurotransmitter, while GABA is an inhibitory neurotransmitter. This means that noradrenaline increases the activity of neurons, while GABA decreases the activity of neurons. Noradrenaline and GABA are connected in a number of ways. For example, noradrenaline can increase the release of GABA from neurons, but GABA can also inhibit the release of noradrenaline from neurons. This means that these two neurotransmitters can work together to regulate the activity of neurons in the brain. Now, the balance between noradrenaline and GABA is important for maintaining normal mood and mental function. If noradrenaline levels are too high or GABA levels are too low, this can lead to symptoms of anxiety and depression. During the menopause, levels of estrogen decline. This can lead to an increase in noradrenaline levels and a decrease in GABA. This imbalance in neurotransmitters can contribute to a range of menopause-related symptoms such as anxiety, tearfulness, depression, difficulty in sleeping. Now, noradrenaline is a neurotransmitter and a hormone that plays an important part in bodily function, including helping regulate your mood and your anxiety levels. Noradrenaline levels can be influenced by a number of things, so like stress can contribute to the symptoms of anxiety and depression, and we also spoke about cortisol yesterday. Sleep is also regulated by noradrenaline, so noradrenaline helps regulate that sleep-wake cycle. High levels of noradrenaline can make it difficult for you to fall asleep and actually stay asleep as well. It also helps improve our attention and focus. So low noradrenaline levels can make it difficult to concentrate and pay attention. Noradrenaline is also really important for heart rate and blood pressure. It increases our heart rate and increases our blood pressure, and this is part of our fight or flight response, which helps the body to prepare for danger. Noradrenaline also helps with regulating our metabolism levels and energy levels. It's produced in the brain and adrenal glands, which are two little organs that sit on top of the kidneys. It's released from the adrenal glands in response to stress, and again it helps to prepare the body for that fight or fright response. Noradrenaline is also released from nerve cells in the brain, where it acts as a neurotransmitter. It binds to two types of receptors, alpha and beta. Alpha receptors are found in blood vessels and beta receptors are found in the heart, lungs and other organs. Now, when noradrenaline binds to alpha receptors, it causes blood vessels to constrict, which increases our blood pressure. When noradrenaline binds to beta receptors, it increases our heart rate and also increases our blood sugar levels as well. So, noradrenaline can be affected by a number of factors, including stress, diet, exercise, and sleep. High levels of noradrenaline can lead to a number of health problems such as anxiety, high blood pressure, heart disease, whereas low levels can lead to problems such as anxiety, depression, fatigue, difficulty in concentrating as well. Now let's talk about GABA and the GABA neurotransmitter. It's the main inhibitory neurotransmitter in the brain. It plays a crucial role in regulating our mood, anxiety and our sleep, and other functions as well. GABA receptors are found throughout the brain and spinal cord, and they're responsible for mediating the effects of GABA. Now, during the menopause, when levels of estrogen and progesterone start to decline, what happens is this can lead to a number of changes that happen in the brain, including a decrease in GABA function. Now, low GABA function has actually been linked to a number of menopausal symptoms, such as, again, anxiety, depression, fatigue, tearfulness, and sleep problems. Now, Utrogestan, which is a type of hormone replacement that you might be aware of, it's a body-identical hormone that contains progesterone. Now, this progesterone is converted to a metabolite called allopregnanolone, which is a GABA A receptor and agonist, which means allopregnanolone binds to and activates our GABA A receptors, increasing GABA function. Utrogestan has been found to help improve GABA function and reduce symptoms of anxiety, depression, and also help us with our sleep. So it has some really good beneficial effects. Now, Utrogestan is generally safe and well tolerated, but it can cause some side effects such as breast tenderness. Some people might have some irregular bleeding. Some people might experience some bloating. But we are aware that that the Utrogestan can help the GABA receptors during the menopause. It increases our GABA levels. And so Utrogestan, as I said, is converted to allopregnanolone, which increases GABA levels in the brain, which allows us to help focus and enhance our kind of memory function as well. So making the Utrogestan more sensitive to GABA means the GABA receptors are more likely to be activated. It also reduces the glutamate inhibitors as well, which helps improve GABA function. Now, HRT can help improve the balance between noradrenaline and GABA and reduce menopausal-related symptoms. Hormone replacement therapy can help improve the balance. It can help improve your symptoms as well. And if you want to know more about your menopause, be educated and be empowered, then book with Pause & Co Healthcare today and hopefully see you soon. Take care for now.